So the next presenter is me. I'm from the University of Texas at Arlington, and I'm going to be talking about incorporating public health performance measures and addressing public health in regional planning efforts. So I'll be talking about the presentation, just a little bit of orientation to what we're trying to look at. Really focused on looking at the strategies that different MPOs are using for incorporating public health into their transportation planning efforts. Then I'll have a specific case study where we took some project level performance measures and applied them to the city of Arlington. And then looking at what the action strategies for different MPOs could be moving forward. So what we've got initially are regional transportation authorities becoming more interested in incorporating public health into their plans. Local governments, Safe Routes to School represents one of those programs that we've got that's trying to address public health issues. We also have relationships that we're noticing that directly relate infrastructure to public health. And some of the performance measures that we're looking at, especially at the project level, really are trying to directly address those relationships. And although it's not a federal requirement yet, we can see where there could be opportunities for planning agencies to really focus on public health as serving our need for livable communities and the broader public good. So what we did in this particular study is we focused on 10 different MPOs throughout the country from a variety of regions, West Coast, East Coast, and explored the way that they were addressing public health in their regional planning efforts. We've also looked at the use of performance measures, both at the strategic level and at the project level. And then also explored the different ways that health impact assessments are being used to accomplish these assessments for public health. Often these are going to be applied at the project level. And then we also specifically targeted EJ analysis because we're seeing that as an opportunity for really focusing on public health and looking at livability in a more comprehensive way rather than a more simplistic assessment for these communities. So when we look at the different areas that the regional planning efforts can focus on, safety, air quality, physical activity, equity, and connectivity, we'll see that some of these, obviously, MPOs are already addressing pretty well. This is something that they're familiar with. It's a matter of now translating what they're currently doing and focusing that efforts to more specifically address public health. And then we also, you sometimes have project performance levels at the project level, but they're going to need to be involved in the actual project selection process for us to count them as being important. Otherwise, they're not really integrated into the planning effort. They're just performance measures that they've identified. So this gives a list of the different MPOs that we looked at. We even included Nashville in the study, so we're covering some of the our respective MPOs in the center. And what we notice, as I said, all the MPOs are addressing safety. They all consider that an important outcome to be focused on. Most of them are focused on air and air quality. And we even see quite a bit of consideration when we're thinking about physical activity, when we're thinking about equity. But what we're not seeing is we're not seeing them incorporating these at the point of their forming their TIP or their individual program selections and project selections. We're not seeing that, that being comprehensively adopted. And I think it's because there's a struggle at coming up with the specific performance measures that they might want to apply, and having those performance measures translate across all the potential partners that you'd want to have integrated into this planning effort across public health and the other communities. So this is just reiterating what I just said. The fact that we're not incorporating them at the project level really shows an opportunity for a lot more growth in that area in the future. So here we see some examples of some of the system level performance measures that the different MPOs are adopting. And we've got the MPOs there, over there in the far column. And then we can see that they move across these different domains. We're looking at vehicle miles traveled, accidents, crash rates, accessibility, where we're looking at accessibility to food, other livability concerns that fit very well with livability public health issues. At the project level, we see that safety and physical activity are really closely linked together. While a bikeability and walkability measure usually focuses more on the physical activity side, that doesn't mean that it's not also addressing some of the safety issues at the same time. But we're not necessarily explicit about that, and there are some gaps potentially between those two. But the primary reason why we need to have this recognition of overlap is safety concerns amongst individuals is likely to contribute to or serve as a deterrent to them engaging in physical activity. No one wants to engage in physical activity if they feel threatened or are at risk. But in addition to these general facility elements, the built environment, what does the land use look like? Other neighborhood characteristics such as crime. These are also potential factors that can be incorporated here when we're assessing performance levels. And I think that the example we had earlier when we were looking at the Safe Routes to School presentation, I think that shows that interest in trying to incorporate some of these other factors into looking at which projects really make sense at this individual project level. So for the health impact assessments, these are evidence-based approaches that are used specifically to address public health. They're usually at the project level, but not always. Here, MPOs are typically using them to address proposed projects. So this is where they're using them to try to assess which ones to include into a TIP. They also might be used to try to look at an existing problem and then also how to mitigate the future concerns associated with it. And then in a more broad strategic effort, they might be trying to address a health impact assessment for addressing policy or implementation. All right. So for environmental justice analysis, we're not seeing that widely adopted amongst the MPOs yet. They're really less frequently using the public health indicators. We see them in California and in Atlanta, and that was it of the four that we studied. And to me, that seems like a significant gap right now where we're not really trying to use the public health indicators as well as we could across to address the needs of the most at-risk populations. Some of them were focused on using direct measures, such as the population engaging in 30 minutes of physical activity, or it could be a proxy measure looking at travel distance or travel time to parks, which is clearly very much a proxy measure for whether physical activity would occur, especially when you're putting it at a 30-minute travel distance. But those are the measures that are being used by some of the NPOs. One of the things that we know about our regional assessments of air quality is that it can miss hot spots, and that it isn't necessarily going to be able to recognize at-risk populations or built environment problems that are decreasing the air quality for specific EJ populations or non-EJ populations. Once again, for air quality, they are using proxy measures and direct measures, where it could be asthma for a direct measure or distance to a transportation facility being a proxy measure. So here we're going to move into the case study for Arlington. And here we're focused primarily on safety and physical activity performance measures. And this is actually building on an earlier TRCLC project that we presented last year. So I'll just briefly reorient y'all to our measures and continue to look at the differences. We're specifically targeting EJ communities versus non-EJ communities in the city of Arlington. All right, so here in the city of Arlington, these are the different census block groups that we included in our study. These numbers are indicators of their environmental justice index that our NCT COG has created for assessing how large of a environmental justice population, or how significant the environmental justice population is in this particular census block group. Anything greater than 10 is considered an environmental justice population in our NPO. And so what we did is we've got these 3 non-environmental justice census block groups, and then we have these other 12 environmental justice census block groups that we investigate the infrastructure in. So we're focused only on the major arterials, minor arterials, and the collectors in this particular study. We did not look at the individual local streets. We're collecting data using observations, Google Earth, direct observations, and completing the pedestrian safety and bicyclist safety assessment, and the walkability assessment index and the bikeability assessment index, which are focused on physical activity. And these are the indexes that we introduced and presented or at least presented one of these last year. And then we have a separate form that we're completing for each of the intersections and each of the segments. This gives you an example of how we're grading these. They'll get a score. Each of the segments and intersections will get a score from 0 to 1, and then they're going to be translated into this color code to give us an idea of the impact that they're having either on safety or on physical activity. And so these analyses are broken up into both the segment and the intersection across each of these measures. Okay, here's an example of a few. One of the things you should notice very quickly is there's nothing green on here. That's going to be a clear conclusion that we have at the end of our story here about the city that I'm fortunate enough to teach in, that we don't have very many green facilities for pedestrians and bicyclists. So when we look at safety impact levels by the census block groups, most important thing to notice immediately is everything seems to be way more on the negatively impact, at least minimally or not, and not so much on the positively impact. We do notice that for pedestrian safety, the EJ areas actually have a little bit better performance, surprisingly. But for all the rest of it, it's all pretty bleak as far as how nice of an environment we have for bicyclists and pedestrians in terms of safety. Correspondingly, for physical activity, we see something similar, except for there's really not much of a positive impact and there's really not much of a negative impact. It's all kind of in the middle, leaning towards negative in most cases. It's because there's really not been any effort to do anything unusual in Arlington other than maybe not provide sidewalks. There's the bike lanes, I think, are restricted to immediately around our campus, and I don't think they connect to anything else in the city. And we certainly have some landowners who are very happy to put signs out in their yard saying, "Do not put a bike lane in front of my house. It'll decrease my property values," somehow. So our conclusions here are the EJ community facilities are somewhat better than the non-EJ communities, but that's saying they all suck too, because the city has not really made a lot of effort to create a wonderful accommodating location for pedestrians and bicyclists. And that's really the big conclusions about where we're at. It would be nice to try to look at these for some different areas and implement them in some other locations, see if perhaps they can grade out a little bit better than Arlington, because we're not going to be improving Arlington anytime soon, I don't think. All right. So the last thing I want to present here are looking at some of the steps and challenges that we have in developing health-related indicators. So this information comes from some interviews that we did with the different MPOs and trying to identify some of the challenges they had experienced in developing health indicators and integrating them into their planning processes. So clearly one of the key things when we're looking at data is budget, and how much can we really invest in trying to track yet another piece of information. The other challenges really are the MPO functions a lot at the regional level, but you need to be able to translate regional down to project level, and so trying to deal with the geography and the translating it to localized issues is a really big challenge and something that requires a lot of careful thought for successful implementation. Collaboration, connecting with the pertinent partners. Where are they? Who are they? Who can really contribute to improving the overall regional planning effort? Then aligning with those partners becomes a challenge, because everyone has their own goals and objectives, and we need to be able to align those together and to decide how to measure, what to measure and how to measure it. Now, at one of the conferences that I went to, there's a big difference between transportation professionals and health professionals when valuing safety. They look at our value for a statistical life when we're doing crash reductions and just cringe. They're saying your $4 million that you're assessing a life at has no real validity, and we don't relate to that at all. And so there's a real disconnect when we're talking about different communities. Then lastly, just engaging in appropriate outreach. So for short-term to mid-term strategies, identify the motivation, develop a working group or standing committee would be a nice starting spot, which can help develop prioritized performance measures. And then long-term, you can look at really developing more of a formal integration, tackling some pilot projects, really trying to integrate public health into those. So for conclusions, MPOs are already focused on air quality and really need to work more on integrating them into the public health performance measures into their transportation improvement programs, really addressing the project level. And then more of a focus on disadvantaged communities. Using public health performance measures would really be quite helpful. And then to get started, really the first step is get a working group and try to connect with the relevant partners that are out there in your communities. With that, thank you.